And now to the pandemic. COVID cases starting to increase, and yet another fight over where to wear a mask. A federal judge in Florida just voiding the federal rule that requires a mask on public transportation. The same rule that was just extended by the CDC due to rising cases. And Philadelphia just brought back its mask mandate after seeing a big spike in cases. Washtenaw County remains the only local county classified at the medium level by the CDC for its case counts, but other areas are also noting increases fueled by the BA2 subvariant. 7 Action News reporter Kimberly Craig is asking local officials, do we need to be taking more precautions?
Public health officials say COVID cases are increasing, and there's one thing they all said when it comes to getting through it.
If your test is positive and you do have a COVID infection, you should let your doctor know. And that's because we now have very good treatments available.
That's because as COVID cases start to increase, doctors specializing in infectious disease say there are antiviral medications that work well to decrease the risk of dying or even being hospitalized.
Ideally, you start them within 5 days of your first symptom appearing. That's when you really get the benefit. These treatments are for people who are at high risk for either becoming hospitalized with COVID or dying from COVID.
We're reporting 100 to 200 cases per day now, so that's right up there with some of the other surges that we've had.
And that increase in cases has the Washtenaw County Health Department reporting the risk of transmission at medium. And what's spreading overseas and here at home is the BA2 subvariant of Omicron. These graphs show what scientists at Henry Ford Health are seeing. In the yellow on the left is the BA2 strain in cases from December. On the right, you can see in March how it's grown.
If you have any risk factors for severe COVID, things such as immunocompromise, obesity, chronic liver, lung, kidney disease, it's easy enough to wear that mask. And if you're at high risk, I would recommend it.
Health officials say being vaccinated and boosted is key. U of M epidemiologist Dr. Lorraine Washer urges those who are over 50 or those who are immunocompromised to get that second booster.
And that's actually helpful as well to decrease those chances of getting symptomatic infection, but particularly for decreasing your chances of getting severe disease and ending up in the hospital.
And it wouldn't hurt to talk to your doctor now about those antivirals.
You can talk to your primary care doctor, you can talk to an urgent care doctor, and really figure out how you would access that. Again, doing it early is important.
People, if you're sick, stay home. There's just no reason to spread the germs. And while the biggest risk is for the older population and people who have medical problems, all of us, by taking those steps, can certainly make everyone a little bit safer.
Kimberly Craig, 7 Action News.